Okay, what fertility treatments are out there? Well, there are lots, and it's also got which would I recommend. That is such a individual one. So really, the first thing I would recommend, you've been trying for a year, possibly just over a year, it's not happening. Okay, time to get some stuff checked out. Go to your doctor, and I would say straight away get referred to a fertility clinic. Okay, that's the best thing because they know exactly what to do. Okay, and they know exactly where you're going, and they're here especially for the reason of fertility to help you become as fertile as possible. Now, the first thing, go get some blood tests for yourself. You need to check your thyroid functions, prolactin levels, and other hormone levels. Are they all okay? And then get that man tested, okay? Have a semen sample. Don't go through anything before at least your husband or man, your partner has been tested, because that can be huge. Especially now, look, over the last 100 years, the male sperm has decreased by 40%. And so now more often there has, the male sperm is a huge factor, okay? After you've been tested, after the male has been tested, then, and if both of those are showing a physical reason why you're not getting pregnant, then of course there's quite a few things. I'm going to go through, I've written them down because some of them have strange names. So, first of all, you can have a laparoscopy, and this is examining the uterus, your fallopian tubes, and ovaries, okay? It's like with a very small telescope. And that's a really great way. You've got a hysteroscopy, and this is the inspection of the uterus, identifying any issues within the uterus. I had all of these, okay? Then there is, this is a strange name, a hysterosalpingography. Hopefully I said that right. And this is where some dye gets injected into the cavity walls of your fallopian tubes or uterus, and to see if it's clear. And this is all done through x-rays, okay? It's quite a full-on one, but again, you need to know if your tubes are clear, okay? So again, important. Then there's also a surgery which is recommended depending on what's going on for endometriosis, if there's any adhesions, polyps, fibroids, uterine. There's all sorts of different things that could be going on that they can check with. So there's all these different tests to go through. And then, of course, there's lots of different fertility drugs. There's Cloimide, there's progesterone, and you can see, so I have some of my friends, I had to personally go straight into IVF, but some of my friends, just by boosting the hormones with Cloimide or progesterone, that was all they needed. So really you got to go through these tests and just double check what's going on physically. And your doctor at the fertility clinic, they're brilliant, okay? They're really, really good. They'll be able to let you know each step of the way what's going to be the best for you, because that's most important, is what's best for you. And we've all got different stuff happening within our bodies, okay? And then, of course, there's IVF. Is that then going to be the next best thing, as you know? And so we've got artificial insemination, which is like the IUI, and then we've also got ICSI, and ICSI is the one that I had. So artificial insemination would be getting the sperm and then injecting it into the female body, as ICSI is getting the eggs and the sperm and putting the sperm actually in the eggs, which is what I had to have. So there's all different sorts of things, from getting the tests to then going through and finding out what's wrong within your reproductive systems, and then knowing, okay, what's the next thing to do to go from there. We're all so different. We're all completely different. And your doctor will help you through every step of the way to find out what's best for you in a physical way. Okay? So I hope that makes sense. I think I've gone through all of it. I had to go through every single one of them. They weren't necessarily the nicest thing to go through, but because I was so this is what I wanted, I was willing to do through more. You will live, you'll be okay, all right? It's all going to be all right. So there you go. So yes, lots of fertility treatments out there, and your doctor will help you find the right one that's specifically for you, okay?